Hey friends, if you're watching this video, we are going over GI mapping, how important it is, my son's results with Dr. Kelsey here at Integrative Health and Wellness, who loves
I
GI.
love
Hi. She is an
it.
expert. She did my husband's and stuff, and he's getting great results. And you
Good.
have lots and lots of clients and stuff too. So, what does it look like? Why would someone get it? We talked about Joshua. He's been having just a lot of different issues, and we were,
Right.
that gut brain connection,
Yeah.
some acid reflux he's been having, just a
Right.
lot of things too. So let's see what his results are. And we're going to go ahead and share here and see what all this means. So you kind of explain this to us and
Sure.
stuff too. And if you need this bigger or anything, we can do
It's
that.
perfect because I have this one too with all my
Oh,
notes
okay.
on it as well. So if you just
Okay.
scroll down whenever.
Okay.
So this is going to be about a 6-page report on what's
Okay.
kind of going on in his gut. You'll see that they have the commensal bacteria, they have the bacteriophili, which is just like your telling us if you have some dysbiosis, some opportunistic ones. Those are your bad bacteria classified, but they go deeper into them with the anti-inflammatory stuff like that. Yeast and fungus, viruses, parasites, worms. They're not all of them. Let's keep that in mind. But
Mhm.
also your intestinal health markers. So it's telling us how well you're absorbing, digesting, things like that. And even better, at the end, it will give us a little bit of antibiotic resistance if you're interested in
Mm.
doing that, which, as you can see,
Oh,
he actually
wow.
has one too, and your husband had a couple as well. So it seems like, and I don't think he's really been on antibiotics too much either.
No.
So it'll tell us like if we did have to go down the result of taking antibiotics, if we did, we know what's going to work for your body as well, which I think is important
Mhm.
because they're just
Mhm.
throwing an antibiotic because it's most commonly used. And if it
Mhm.
doesn't work for your body, you're kind of destroying your gut for no reason. I can fix your gut after you have to have antibiotics, but if we're using something that's bad and we have to go 3, 4, 5 antibiotic rounds and they're not doing anything, it's much harder to fix. So it gives us a lot of information, not just about your gut, but like what your antibiotic resistance is as well. So it's kind of exciting to get all that information, be able to show your doctors, no, 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 I can't not have that. It's not going to work for me.
How cool is that?
It's so
I
cool.
mean,
I love that. We do
like,
we do UTI stuff like that too.
really?
And they tell us like what UTI you have, but it also tells us what antibiotics you're resistant to. So you can take it to your doctor and be like, this is not the one,
Wow.
this is the one that will work
Because
for
so many
that.
women get a lot of
And they
UTIs.
go with the same ones over and over again and it doesn't fix it. It's really,
Wow.
really cool. I love that aspect of it. It's really neat.
So, to get this kind of test too, you do have to go through a practitioner, and this is
Yes.
something that people anywhere, right, in the United States.
Yes, I
Okay.
believe you can get it outside the United States, the UK especially. I know you can, but I'm not really sure about everywhere else.
Okay.
I'm really sure you can get it done. You just have to go through an outside doctor that's outside of United, like that's in the United States or anything like that. But it has to be a physician that orders it. You can't just go to somebody who's like just a functional medicine doctor. They
Mhm.
don't have the privileges to order it. You have to have an MPI number and stuff like that.
Okay, so we will put Integrative Health and Wellness, your information below, and
Yeah,
how they can schedule with you too. So,
sure.
so just so everyone knows too, is that on the front end, you're having a consultation first,
Yes.
right? And so that there's health history and just knowing what's going on.
It helps us correlate. So when you come in with your test results, we can correlate it to, I have this symptom, I'm seeing undigested food, I'm seeing this, I'm seeing that. Oh, that
Mhm.
makes sense because this
Mhm.
is what's going on. This is what's going on in your gut. It just helps better for me to do it that way rather than, okay, we do the test and then we come up with all the stuff. But like, I don't know if you have constipation. I don't know
Mhm.
if you have diarrhea. I don't know if you're seeing undigested food. It just helps me be able to correlate it before your appointment and know this is what applies to you rather than this is just what this means.
Okay. Okay,
Takes
cool.
the guessing game out of it.
Cool. Cool, cool, cool. All right. So here we're looking at pathogens.
This is like your scary stuff, like your E. coli, Shigella. A lot of these you'll see more in people that travel. So,
Mm,
like, I've had patients that go visit India and stuff like that where
mm,
the water's bad. You'll see a lot of that. C. diff is also something that you kind of see in hospital settings. So,
mhm.
kids who have
Yeah.
been in the hospital a lot or adults even. Salmonella, especially now with all of the food contaminants we're having right now, it's very helpful in identifying that. Your parasitic ones, those are also ones like you get in lakes. So people who are in Michigan, things like that, you'll see that a little bit more commonly. I've had a couple that have had that. And then your viral ones, adeno and noro. Usually people typically know that they have those. That's your vomiting and diarrhea or stomach bugs that you kind of get. However, they can linger. So if you're not getting it all the way out of your system, that means there's an immune problem going on too that we might want to deal with. But Josh, you can see, has none of those, which is great. Those are a little bit more harder to kill off. Not harder, but they take a little bit more time to get out of your system. But Josh does okay with that.
Okay.
I know. So I think he might be your culprit.
Okay.
Remember how I said that?
Yeah.
H. pylori is very, very common. It happens about 50% of Americans have H. pylori. Okay. So, and everybody's like, well, then it should be fine. Well, no, because it's the most common thing that happens. It's a common cofactor with GI cancer. So we always want to, if I even see it in your system, I want to get rid of it, because if we can get rid of it, why would we keep it in there? But you can see when you have H. pylori, you get a lot of abdominal cramping, diarrhea, constipation, a lot of like acid reflux type stuff. But a lot of it is due to dyspepsia. So I'm wondering if that's why he was having a lot of that acid reflux a while ago. Not, I mean, we were in the other office, so I guess 6 or 7 months ago. But he was having a lot of acid reflux. And I'm wondering if that's part of that portion for him. But it can cause nausea. It can cause all that stuff. And for him, I think his correlates a little bit later in the game on the paper. But the virulence factors that you're seeing on the side, those are correlated with different things like ulcers. So ulcers also common with H. pylori, gastric cancers, things like that. And they go into detail as to which each one of these do. I've never really had anybody come up real positive with it because we kill it off before it gets to that point. And usually if you're way, way higher, his is definitely, his is labeled high. Whereas I think your husband's wasn't labeled high. It was just there. And remember how I said saliva spreads it. So if your husband has it, if your kids have it, and you're drinking after them, you all have it. Therefore, you all should kind of take that portion of that treatment that we go over and do the whole family, because then you can kind of kill it off. So he might be, I mean, I don't know. We haven't done you or the other kiddo. But so far he's the culprit. He might be the culprit in that one. So he's got that. So I think that comes up a little bit later. And with Josh's, all of his kind of correlate. So near the end, you'll get a kind of better idea as to where my thought processes go with him. But that's a big component of his. When you go into the commensal keystone bacteria, these are your good bacteria. But remember, we can have too much of a good thing. We can always have too much of a good thing. Now, Josh is...
Ooh, sorry. I hit something here. Hold on 1 second. Share. Back there. Okay. Well, 1 second. I think my review. Okay. All right. Okay. There we go. Okay.
So Josh's isn't terrible. You'll see a lot in the green. That's fantastic. It means he's being fed pretty well. It means that he's getting a lot of the bacteria that he's supposed to be getting. Now, there's a couple common things with your husband's as well. I don't know if you remember his results, but I have elephant memory. So the enterococcus on his is yellow. Now, I always go after things that are also in the yellow because we want to be preventative, not just killing off things that are bad or too little or too much. We want to get it before it gets bad. So his is enterococcus. That is usually associated with decreased digestive capacity.
Oh, okay.
Which goes hand in hand with the H. pylori.
Okay.
We have a decreased acid problem. We're not breaking down our foods properly. We're having a little bit of an issue. So we can see constipation with that. We can see SIBO, which is small intestinal bacterial overgrowth. Remember, I said you can have too much of a good thing and then a dysbiotic relationship. So it's very important to realize that. Now, with Josh, I don't think he has SIBO because you can see that the majority of his are well within normal limits. They're just kind of verging towards that yellow. His enterococcus a little bit close to where I'd like it to be. But then you'll also see his lactobacillus. Now, the thing with lactobacillus is it's super, super common in probiotics. And I'm not a huge fan of always throwing somebody on a probiotic, especially before I have a GI map, because that's the most common one.
Okay. And I just want to stop here too, is that, we always think throw probiotics, probiotics. And I
Or even yogurt.
before I knew this about me, it made me break out.
Yes. Or it gives people more digestive upset because they have
Yeah.
too much. My mom's one of those people. I'm still trying to get her to do her test. Because if you have too much lactobacillus, that can also cause the same thing. And lactobacillus is what you find in those Greek yogurts that everybody tells you to eat. And it's most common in the over-the-counter probiotics that you're taking as well. So with that, the same thing, we're dealing with the decreased digestive capacity. We're having some issues with breaking down foods. We're dealing with an overgrowth of too much good bacteria, and that can cause gas and bloating and things like that, which we're seeing with Josh as well. So those are the two things on his, and that was actually high in your husband's as well. I think lactobacillus was going towards that, really towards that yellow as well. So that's a common thing for him. Now his bacteriophili, that's the other reason why I don't think he has SIBO, right, guys? Remember, because I said that tells us about dysbiotic relationship with your gut. His are both well within green, and then the biggest portion of that is that ratio. We want that ratio to be low and in the green. Okay, so if that's going up, and that means that we have some serious issues. We got some serious dysbiosis going on. If we have one of them up a little or down a little, we have some dysbiosis. We need to fix whatever infections we got going on or whatever dysbiosis we have. But if his is perfect, that's why we can pretty much mark that off, that he does not have a dysbiotic gut. He just has some infections we need to treat.
I think I'll have to double check it, but I think this bacteria, the wolfberry, the ninja wolfberry, feeds this guy.
Yes, it does.
So mine was really good years ago when I got this done too.
Yes.
So that's very cool.
Very antioxidant.
Yeah.
Yes.
Yeah.
That's very formulated by that.
Or something.
So again, this is another case where I look at this and I see two high ones, and they're the common ones, staph and strep. Now, if one was elevated, I wouldn't be as worried. But because both are, I'm like, we've got something that's growing here. And then we have the ones up top that are a little bit high too. Now, these really just, a lot of them mean inflammation. Okay. So we're dealing with inflammation. Those top three are inflammation. Okay. So, but when we get down into more like the staph and strep, we're dealing more with an issue of low stomach acid. We don't have enough stomach acid to break down those things, because those things are on a lot of foods. Okay. So even when you're pregnant, another example of like when you're going through pregnancy, they test you for strep B before you give birth, because it's dangerous to pass that on to baby. So we see that quite frequently. So like, let's fix it before it happens type deal. So we're not dealing with that. We don't have to have antibiotics during pregnancy. We're not causing any issues. For his, it's elevated and it's high.
So one of the things with pandas, which we worry with kids and autism, is strep. And I have always said, when his tonsils are big, he has very odd behaviors and pandas like, tendencies. So this is very good to know and be validated.
And he was, well, no, we did this before he got sick. I was thinking maybe he did this after he was sick. And pandas is very complicated too, because it's classified as this thing that just like happens and then people grow out of it. And that's not necessarily the case. And like sometimes kids they have really good immune systems and they can fight it off pretty good without you even knowing they have strep. So they go undiagnosed, but behavioral stuff is the most common thing that you see with pans and pandas. And sometimes they do grow out of it. I'm not going to say never, but a lot of times they kind of hang on to some of those behaviors, especially through puberty, which is where kind of Josh is at too. So he's dealing with at least a whole exponent above. Okay, so both of those are whole exponent above. They're not just a little out of range. They're quite a bit out of range. And then the top one, bacillus, of course, that one's really, it's real dang close. So we always want to look at all of them. But E. coli, enterococcus, he has that too in his system, which is not uncommon. Again, I don't panic when I see those things. It's just something common. The commensal overgrowth, he's got 2 of them. That one's awfully close. The metho. That's what breaks down our fatty acids.
Yeah. Yeah.
And with Josh, that's important. That decreases your inflammation. You're like, fatty acids, those are great for us. We need to take them. But with Josh, he's having a hard time breaking it down.
Yeah, and he has gas when I give him the fish oils and
So
stuff.
that
Yeah.
explains a lot of things
Yeah.
for Josh anyways. But it helps break down those fatty chains, because if we can't break them down, you're just causing issues,
Mhm.
right? So
Yeah.
if we don't take care of it, then we just end up with a buildup. And like I said, you might as well call that positive, because
Okay.
it's really close.
Okay. So this area here. Okay.
So the next ones are inflammatory and autoimmune. Okay, so you can see he has one, the Citrobacter. That's not uncommon. I see that quite frequently. His is still 2 exponents above. I'm not too concerned about that one,
Mhm.
because that can be an overgrowth of too much good bacteria.
Okay.
Okay. Enterobacter is another one that is a good bacteria that can be overcharged.
Mhm.
Okay, so too much of it. The other ones can be associated with so many different autoimmunes, as in diabetes. So we can see if you're prone to being diabetic, if you're down that path, or if you're going
Mhm.
down that path. It can tell us if you have too much overgrowth of yeast, which Josh does not. You can see that in the next part of it. But RA, lupus, SLE, all
Mm.
those things you can kind of see on there. Scleroderma. These are all autoimmune related conditions. So that tells you how much our gut is related to autoimmune stuff that we deal with. His are all they're high.
Mhm.
So we want to watch that. And there's some other thing, like near the end, it tells us a little bit more about like why we are a little bit concerned about his being high. Because some people, it's like, okay, it's there, let's work on it. But his is a little high and a little concerning on other stuff. Yeast and fungus, those are pretty common. I see it quite frequently, but you're doing a great job, Mom. He's actually keeping his candida and stuff under control.
Amen.
Yeah,
Wow.
he's doing a great job. The viruses, cytomegalo and Epstein-Barr, we see this a lot with patients, okay? This is the one where people are like, I had mono when I was a kid, and they feel
Mhm.
like they keep getting flare-ups.
Mhm.
So this will tell us if it's in your stool, which is a really good indicator. Like he has none detected. DL means it's not in your system at all.
Mhm.
They can't see it at all. So that's really, really positive that he's not got latent viruses going on in his system either.
Okay.
Parasites, he's doing great. Mom's
Okay.
been doing stuff on that too, so that's great for him. Those are the big ones. Like I said, these are not all of them. So if you're getting like kiddos who have like the common pinworm thing, they're not testing for pinworms. That's common. People already know that that's happening. But it's testing for other ones, things like that you eat after you eat rice that's not been properly reheated, things like that. It tests for all those. A lot of these I see more in kids or adults that have traveled.
Mm.
So like missionary kids, things like that. I see it a lot.
Okay.
His digestive stuff, this is where it kind of ties in all together. Okay. So this is the important part with Josh. So he has his steatocrit, that's like fat, okay, your fat absorption, which goes hand in hand with that fatty acids where he's not breaking them down. His is in the yellow. We want it below 15. He's at 6. It's not the worst I've seen, but he's having an issue breaking down those fats, which fats are very helpful with our brain
Right.
and inflammation.
Mhm.
So he's not breaking those down. So even the vitamins that remember we talked about earlier, we can pay for vitamins, we can take vitamins, but you could be paying for very expensive poop and pee. And unfortunately, I feel like that's kind of where we're at with Josh with the not breaking down of the vitamins or even the food that he's absorbing, because Mary does feed her children very well. I do know that about her. So I do know that this is not a improper food intake. They're eating out all the time. They're doing none of that. So his steatocrit is in the yellow. So he's having a really hard time breaking down those fats. And then his elastase is his pancreatic function. So we're
Oh.
having an issue with that pancreas. We're just above. So we're at pancreatic dysfunction, not insufficiency.
Okay.
Okay. So we're looking at things like, okay, he needs some help with some digestive enzymes. He needs some help with pancreatic enzymes to help break down that food, increase his acid. We need to increase acid. I know that sounds crazy because everybody's on proton pump inhibitors, the Prevacid and Prilosec and all those things to help calm down the acid because we feel like we have too much acid. But most kids, even with Josh having acid reflux, it's not reflux that's causing the symptoms. It's a weak sphincter that causes that. It's not actually too much acid. I am very hard to find someone who has too much acid in their stomach. is
Mhm.
very rare.
Right.
Maybe the people who drink lots of kombucha and stuff like that, like on a daily 3, 4 times a day, you might see that, but not typically. So that's a big portion of Josh's results right
Mhm.
there. Beta glucuronidase is an indication of his liver detoxification. So
Mhm.
his second phase where he's breaking down his hormones.
Mhm.
So we're doing good with breaking down our hormones. He's actually doing pretty good. No issue with him breaking down hormones. His liver's detoxifying okay. So the liver is doing its job. So we have right now we have an issue with pancreas and we have an issue with fat breakdown.
Okay.
Occult blood, that would be more like, especially with that H. pylori, no ulcers. Occult blood is more upper GI bleeds. Don't think lower GI. You can maybe think small intestine, like
Mhm.
Crohn's colitis.
Mhm.
But don't think anything like lower
Bowel. So
colon.
yeah.
Secretory IgA is our immune system in our gut. So Josh's is a little bit lower than I'd like it to be, but we could get it up higher.
Okay.
So he could be on zinc, things like that. That would help
Yes.
kind of
Okay.
absorb some of that issue that he's having. Anti-gliadin is gluten.
Oh.
So he's doing very good. They're very good.
Wow. Wow.
So he
And
does this.
he's not gluten
I
free.
was gonna say, so he
Yeah.
has no issue with gluten actually. So that's the important
Wow.
thing that everybody always thinks gluten-free is always the best thing. It's not necessarily the case. Some people can handle gluten and it's fine. He's
Wow.
totally fine.
Don't tell
I
him all
didn't
that.
I didn't eat gluten for 6 years and mine came up high. It was terrible. You'll see that in my
Okay.
results when she posts mine.
Okay.
Your eosinophilic activation protein is your eosinophils is either parasites or allergies.
Mhm.
So he's actually doing really, really well
Great.
with either both of those, which we see that he doesn't have any obvious parasites, and we see that his allergies are doing decently well and being
Yeah.
taken care of. I
Um,
know this is the one we talked about. Calprotectin is the gold standard for IBD and IBS and
mm,
inflammation. Josh's is very high. Now, I think that's mostly because of the H. pylori.
okay.
Okay, so if we can fix the H. pylori and the staph and strep in his system, I think that we can get this better. But the only way to do that is to add more acids to his diet to break down those foods and
Mhm.
actually get the omegas and stuff working in his system. Because right now, again, we're paying for very expensive products that aren't being absorbed. Therefore, they're not decreasing his inflammation in his gut. So he's
Yeah.
very inflamed.
Wow. Wow.
And then, of course, this is the antibiotic resistance if we were to treat his H. pylori with an actual antibiotic.
Okay.
So he doesn't do fluoroquines very well, which I don't like it anyways.
Okay. That's okay. So here, here's the thing, because a lot of people are going through this and they're like, okay, tell us what to do. And they're going to want to copy
Right.
this. And I'm going to say, no,
Mm-mm.
we're not going to tell you the results of what he's going to take because you need to get your own GI map.
Yeah, it doesn't fit for everybody.
So that you can get your thing. So I'm going to leave out Josh's supplements, all the things that we're going to use. I might talk about it in the future or something
Yeah.
as things go. But if you found this to be helpful, which is awesome, like
Yeah.
so much that you can see
Yeah.
in this is so worth it.
Yeah.
So, your initial pay for your initial
Yep.
consultation. These tests run about
300,
330.
310 cash. If you
Okay.
do cash price, you can run it through insurance like we talked about before. Some of them do take it. Now, keep in mind that's just like anything else you do insurance wise. You might have a copay or whatever that's a little bit higher. So always ask your insurance company, give them a call. This is the codes, and then they can give you a better estimate. But sometimes it's just easier to go cash rate. It's almost always cheaper. Some people pay 400 when they could have paid 3.
Mhm.
So always look into your insurance plan and what's supported by it. We do take I don't know if they take HSA or FSA cards, but we do for your
Mhm.
results.
Mhm.
So you can always do it that way. But for the test, we don't profit off the test. That goes straight to the company. So we
Yeah.
don't deal with that part of it.
Yeah. And it takes about 2 weeks or so
Mm-hmm.
from the
10,
time
10 business days.
once you send it in and stuff like that. And then when Dr. Kelsey has an opening, she
Mm-hmm.
can do a recording like this or come to
Yep.
the office and see her as well.
Yeah.
So I'm looking forward to see what we need to do.
It's
And
exciting.
then how often should someone get retested, you think?
For cost purposes, like people are going to notice a difference in how you're feeling. Okay. So if you know that you're starting to feel better, I'm not apt to push people into testing again. I personally did mine a year out because I feel like that's a good time frame for my body to like settle down. I had a lot going on with mine, and you'll see mine a little later. I've given Mary permission to share my before and after results. Um, but if you can afford it, 6 months is great. If you can't and you kind of just want to wait, a year is optimal. I wouldn't
Mhm.
go longer than a year because then things change.
Mm.
Our bodies keep changing, stressors change. There's a lot of things that can change in our bodies if you go through pregnancy or whatever. There's so many
Mhm.
things that change. So it's good to kind of get in as much as you can. If you can afford it, great. If you can't, then waiting on it's best.
Mhm. All right, there's the bell. All right, thank you. Thank you, everyone. And more information will be in the description below.
Yeah, he's got a lot of information, babe.